Hi, my name is Tiffany. I'm going to be your student physical therapist today. I'm going to do some examination techniques on your shoulder to check for instability in your shoulder, anterior and posterior. Is it alright if I do some special tests on you?
Yes.
And also this is going to be recorded for my class. Is that okay? Alright. So the first test we're going to do is the load and shift test. This is to test for anterior and posterior instability. The sensitivity of the test for anterior is 0.5. The specificity is 1. There's no positive likelihood ratio, and the negative is 0.5. For posterior, the sensitivity is 0.14. The specificity is 1. There is, again, no positive likelihood ratio, and the negative likelihood ratio is 0.86. This is a good test for ruling in a condition. So what you're testing for is laxity in the shoulder joint. So what you're going to do is you're going to load it by pushing it in, and then you're going to move it posteriorly and anteriorly, and you're looking for laxity. So if it moves 25 to 50%, it's a grade 1, and 50% or greater is a grade 2. The next test we're going to do is the apprehension and relocation test. This is a test for anterior instability. The sensitivity and specificity of this test for pain is 0.54 sensitivity, specificity is 0.44. Positive likelihood ratio for pain is 0.96, and negative likelihood ratio for pain is 1.05. For apprehension, the sensitivity is 0.68. For specificity is 1. Positive likelihood ratio is, there is not 1. And the negative likelihood ratio is 0.32. So for this test, what you're going to do is you're going to have the patient lay flat on the table. And you're going to want to adduct their arm to 90 degrees. And you're going to want to externally rotate. What you're doing is you're looking for pain or apprehension or surprise on the patient's face. She does not have a positive test, so the relocation would not be warranted. But say she did have a positive test and she showed pain, I would push posteriorly on the joint and then again externally rotate, and she should be able to go farther and have no pain or apprehension.